My name is April Hollis, and I'm the Custom Content Editor for Healthcare at SmartBrief. I'm joined today by Maisie Weir, Director of Business Solutions for Zealous, and Tim Garrett, Chief Medical Officer for Zealous, which is a leader in healthcare financial solutions. Welcome, Maisie and Tim. We have a great conversation planned for today, so let's go ahead and get started. I'd like to kick it off by asking you, what are some of the claims process challenges that payers and providers are dealing with, and what's causing them?
Yeah, thanks, April, for having us today. You know, the biggest challenge for both payers and providers comes from how complicated the claims process is. Providers have to deal with the requirements from multiple different payers, and then payers face dealing with a myriad of providers who have different capabilities in regard to things like claim submission, sharing of information, and other things. And then both payers and providers have to contend with multiple IT platforms and different lines of business that have different rules and guidelines. And all of those challenges really serve as a distraction from the main focus of both payers and providers, and that is ensuring a high quality of care for patients and then also improving benefits for members.
I can see how that would add some complexity. Where do payment integrity and out-of-network claims fit into this picture?
So as Dr. Garrett spoke about, it's really just a cumbersome process, and that stems from it being antiquated as well. And that lack of communication between providers and payers and the disparate technologies leads to a lot of back and forth and can really create an environment we see where both the payer and provider aren't seeing eye to eye, right, and aren't able to come to the table. And so the member is getting caught in the middle. Having a solution that supports communication, clarity, and collaboration on claims processing and the reimbursements around it frees up time for both parties to focus on the most important part of that equation, which, as Dr. G alluded to, is the member. Additionally, there have been a lot of moving parts in the market lately related to healthcare requirements and legislation, constant changes that everybody's having to keep up with. And the No Surprises Act has certainly been one of them that has brought quite a bit of complexity to claims processing today.
Thank you. Can you also speak to some of those evolving requirements and provider trends that are affecting these areas?
No Surprises Act, or NSA as we call it, is a really big example of a legislative change in requirements that's really hit the market exceptionally hard in the past 2 years. It's really added severe complexity for both payers and providers, and they're feeling the same pain points around having to follow new time-consuming and costly legislative requirements around their out-of-network claims processing. And while I think everybody's happy that it ultimately protects the downstream member, which is wonderful given the rising cost of care, it leaves both the payer and the provider open to additional unknown reimbursements, which can cause administrative and financial burden to both parties and just really creates a non-cohesive approach to partnering together to support that member. Dr. Garrett, I'm sure you have some insight here given your experience in the market as a provider.
Yeah, Macy, I think you're right. The NSA is a great example of a regulatory change that really greatly affected how payments are made. But the truth is that coding and billing requirements continually change. And it's difficult to keep up with the changes when you're also, like I was saying before, trying to ensure high quality care and also abiding by timely payment requirements. And if you think about that, failing to adjust to coding and billing changes, it creates a gap in payment integrity. And those gaps can allow overpayments to creep into the process.
And what kind of impact does a coordinated out-of-network and payment integrity strategy have on claims workflow and costs?
Yeah, so I think most importantly, it keeps costs accurate and clear for both parties, or really all parties, member included. And that clarity around what something's going to cost and what you're going to be reimbursed is really important to create cohesion and collaboration in the market. I think it also creates less administrative burden for all parties. Ultimately, it doesn't leave the members scratching their heads trying to understand what they're responsible for, what the provider's responsible for, what the insurer is responsible for. It takes a little bit of that chaos out of the healthcare process today.
Yeah, I think you're right, Macy. If I think about that, in my career as an emergency physician, my main job was to replace chaos with clarity. And I think just as you have alluded to, a coordinated payment integrity strategy for both out-of-network and in-network claims does the same thing. It decreases the amount of chaos and uncertainty in the payment process. And doing that not only benefits the payer and the provider, it ultimately benefits the member. So it helps to minimize balance billing, as you've pointed out. It allows clearer navigation in the member's healthcare journey. It lets everyone just make sure that we're on the same page.
Thank you. What does success look like from beginning to end when accuracy and integrity are ensured before paying a claim?
Yeah, April, a highly successful payment process, one that ensures accuracy, is one in which, breaking it down to very simple terms, it's one in which payers submit accurate claims, and those claims are processed in a timely manner. That accuracy is quickly confirmed and payment is made within prompt pay guidelines. And then when there is uncertainty or disagreement between the payer and the provider, then education is provided and disputes are effectively managed, bringing both parties, both payers and providers, to a mutual agreement. And just as Macy and I both pointed out, this kind of efficient payment process benefits everyone. So as Macy pointed out, it decreases administrative burden for both payers and providers, which in turn, of course, decreases cost. But it also, this efficiency benefits members by decreasing uncertainty. We don't have to wonder when a claim is going to be paid or worry about how much we as individual patients are going to have to pay out of pocket. Now, all of this sounds sort of daunting, but this kind of efficient payment process is doable. I think, though, it is true that providers can't be expected to do this by themselves. Payers need a partner, much like providers have billing partners to help them.
Yeah, and I would say, Dr. Garrett, from a payment integrity, right, you're looking at those in-network claims, and an out-of-network claim creates additional complexity, right, in that market for both payers and providers. It's not an agreed upon amount that's going out, right? Nobody knows what they're going to be reimbursed. So to be able to have a successful process that ensures accuracy, but also that integrity of being a partner, right, and coming to the table and being able to negotiate on an agreed upon amount that leaves both the payer and the provider feeling comfortable, as well as taking the member out of that process from any balance bills, as you mentioned previously. No additional costs related to their care that could essentially affect them financially for a long time downstream. So certainly want to have that clarity from an out-of-network perspective to be able to create that collaboration in that market from that perspective.
You mentioned that payers can't be expected to do this by themselves. How does a payer create the success you've described?
Yeah, so I think it's more than just creating success. Of course, you want a successful solution and collaboration, but it's really identifying that right partner to be able to get you to that place where you're creating balance that unlocks value from the partnership, but also creates collaboration in that market. So it's scalability of being able to grow with you, support you as a partner. It's also that experience in the market and our willingness to work and partner with providers on your behalf, right? If you're a payer today, and that customization and sort of collaborative approach to working in that market. And I know here at Zealous, we've been in the market for 20 plus years, but we really do have that experience. And we really want to make sure that the process for all parties involved, member, payer, and provider, is something that they're comfortable with. We never want to leave somebody feeling uncomfortable about their healthcare experience or have an issue with a provider or a payer that could result in downstream stress on that member. So it's really about keeping costs down for members, promoting accurate payment, partnering with that right person who understands that market and is willing to work within it to help you grow your business.
Yeah, Macy, I agree with all of the partner attributes that you've just checked off. One for me that stands out is the experience of the partners' people. I'm really proud of the team that we've built at Zealous. Our team is made up of professionals with deep payment integrity experience and knowledge, and we also have lots of highly experienced clinicians who bring the provider perspective to our work. And because of that, we are really able to truly understand the obstacles that are faced by providers. And we're willing and able to work with providers because, we've been there. We have been a provider ourselves. So we know what those obstacles are and know how important it is for us to overcome those.
Maisie and Dr. Garrett, it was a pleasure speaking with you and learning more about how payers can implement a coordinated out-of-network and payment integrity strategy. Thank you so much.
Thanks, April.
Thank you so much.